Critical Moments is a series that takes you inside therapy. Conceived and created by therapists, actors, and writers, the dramatizations are developed from actual experiences during therapy treatment and from case studies. In today's session, you'll meet Fareed Rogers, a 17-year-old patient at a psychiatric hospital who has a history of violent behavior. Dr. Samuels, a child and adolescent psychiatrist with expertise in violence and trauma, has been brought in to evaluate Fareed and determine whether he should be transferred to a high-risk unit for adults. The Rhythm is My Blanket is written by Dr. Glenn Sachs and features actors Courtney Novella, Douglas Sobin, and Christopher Whitcomb. The episode is directed by Ed Wurzbicki. Our story begins with a meeting between Dr. Samuels and Fareed's therapist, Dr. Lewis. She shares Fareed's history and recent behavior and her belief that he be sent to a locked psychiatric unit for violent adults.
So, according to his file here, Fareed Rogers is a 17-year-old African-American male who was admitted to the hospital 2 weeks ago after he assaulted his girlfriend when she broke up with him. He was then picked up by police in a park yelling and threatening people. He was intoxicated and threatening to kill himself. Fareed was brought to City Hospital emergency room and determined to be suicidal and homicidal and transferred here. He has previous diagnoses of conduct disorder, attention deficit hyperactivity disorder, PTSD, and substance abuse. He was previously admitted here about 8 months earlier after assaulting his high school basketball coach. Since arriving, he has been uncooperative on the unit and is belligerent and occasionally menacing. He resists participation in therapeutic activities. And this past Saturday, he assaulted a staff member, pushing him over a table and breaking his arm. The attack was unprovoked. He became agitated and belligerent on the unit and was very accusatory about staff. We've increased his risperidol since Saturday because we believe his suspiciousness of staff may have a psychotic favor.
That's quite a story. I think I know, but can you tell me why you'd like to transfer Fareed to the specialty unit?
Well, the staff here feels very unsafe. Fareed is not participating in activities, and he's often threatening. One staffer called him menacing, and honestly, we don't know how much we can do for him.
Who does he live with? What about school?
It says he lives with his mother and I think younger brother. Oh, school. He's a senior in high school. No special ed involvement.
Father?
I am not sure. Let's see. It says he's in prison.
Any contact with the father?
I'm not really sure. There's no notes on that.
Any special interests? What does he like to do?
I'm not sure. He does like listening to music. But that's been a problem because he needs to be constantly reminded to take out his earbuds during sessions and in groups. This has been very disruptive, and it's against the rules. He knows that.
Okay. I note that you said he has a diagnosis of PTSD. What's his trauma history?
History of domestic violence, father to mother.
Okay. Thank you. Why don't I meet Fareed?
Thank you. I'll have them bring him down. Fareed, can you please take those earbuds out? You know the rules. Fareed!
Dr. Lewis? I think it's okay for you.
Okay. That's up to you. Why don't I go so you can interview him?
Is that okay with you? Fareed?
Whatever.
I'll be in my office.
Got my team on my back and we making it happen. That's fact.
Thanks for meeting with me.
Yeah, like I have a choice.
Well, I guess that's right, but I don't force people to talk to me. If you'd rather not talk, I can have someone bring you back.
My ass is on a chair, ain't it?
I guess it is. Just want to make sure you know you don't need to talk to me. You don't have to.
Yeah, I get it. So, you the guy is gonna tell him to send me to the crazy and violent unit?
Well, I was asked to tell them what I think. That's why we're meeting. What do you think
About what?
about going to that unit?
Well, I'm not crazy and I'm not violent. So why would I need to go there?
Well, okay, you got me. Okay. I see what you did. Let me ask. Why do you think people assume that you need to go there?
Don't know. You'll have to ask them. To be honest, I think I'm the only sane person on my unit. The doctors, the nurses, the staff. I mean, you want to talk crazy? They should all be certified. They're all crazy and violent.
Why violent?
Oh, okay, so you agree with me that they're crazy?
Look, this is my first time here. I've never met them, so I'll have to reserve judgment. But please, say more about what you mean about their being violent or crazy.
You haven't been forced to take medication?
No.
I think the meds are just to keep me quiet. But, I mean, what difference does it make? I'm locked up here. I can't leave. And they'll just start taking things away from me. They'll take my music away. I mean, you saw her. You saw her try to do that. And even if I say no, I'm thrown in solitary. Have you ever been locked up?
No. No, never.
You don't think that locking someone up against their will is violent? You don't think that forcing drugs into someone is violent?
If I were to ask them, I expect that they would say it was you who've done things that are violent.
Oh, great. So it's to retaliate? So you think that violent retaliation is cool?
No, that's not what I meant. I meant...
Yeah.
that
I know what you meant. Relax. We're cool. They tell you about Jamal on Saturday about me breaking his arm?
Yes, they did.
Let me guess. They didn't tell you what was going on Saturday morning and about why I was so pissed, did they? They say anything about that?
No, not many details.
Assholes. Look, I feel bad about breaking his arm. Jamal is a brother, and even though his job is to enforce your white rules, I feel bad about hurting a brother. I'm not surprised, though, that they left out the most important shit.
Okay, then please. I'd really like to know the whole story.
You serious?
Yes? Will you tell me? Tell me everything.
For real?
Yes.
Okay. You want the whole fucking story? I'll give you the whole fucking story. It started on Thursday. I had my morning meeting with Dr. Lewis. You know, she did her usual thing, asked me if I've been, feeling angry, aggressive, distressed, depressed. I mean, you know the drill. And she hardly looks at me. Her nose just in her laptop. Then she starts asking me about meds, side effects, and blah, 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 blah. So I tell her I had something real important on Saturday afternoon. I tell her I earned it, that I had the points. I can get an afternoon pass. I said my uncle would pick me up and bring me back, and I made sure that she knew it was really, really important. And she said it would be fine if I had the behavior points, so I said, okay, good. We stray, I'm thinking. She let me go. All I needed to do was do what they asked, just wag my tail and look sweet. I didn't really care that no one even asked where I was going or why or what's so important this Saturday afternoon, Fareed. But that's fine. I got the points, got the pass, and I was good to go until I wasn't.
What happened?
I get up Saturday morning, packed up for noon release, arranged everything with my uncle who was on his way. I go to the nurse's station. let her know I'm ready to go. And then I knew something was wrong when there was this blank zombie look on Christine's face, the head nurse. What? I said. I have a pass to go. Dr. Lewis promised. No pass written, she says. I felt my heart beating like it was gonna jump out of me. Look again, I said. No, nothing here, sorry. Call her. She promised. And I knew I said it too loud. Step back from the station. Step back and calm down or we'll call a code. Call a code? Call a fucking code? Just call Dr. Lewis. Then I felt hands on my shoulders and it's Jamal's voice. Calm down, calm down. You're gonna lose points. Lose fucking points? Lose fucking points? You can go fuck yourself with your points. Then I spin around, I push him hard, out of the way, I turned and I ran. I heard a crash behind me. I guess he fell over a table and later they said he broke his arm. Anyone say anything about that?
No, they didn't. But I'm glad you did. Thanks for explaining. Must have been incredibly frustrating when you learned you lost your pass.
Straight up.
So I have to ask. Where were you supposed to go?
What do you mean?
With your pass, what were you planning to do that afternoon?
Wait. For real? You care about what I was doing, where I was going?
Yes, why wouldn't I? Must have been important.
Nah, it just never crossed my mind that someone like you would actually, be interested. You're the first person in all this shit to even ask what I was gonna do, where I was going.
You okay?
Yeah, I'm okay. Sorry, it just fucking gets to me.
There's no need to apologize. Must have been incredibly important.
I'm an MC. I rap. I'm fucking good, too. At least I think I'm good. My crew's good, too. We perform. We teach kids in our hood to perform. We do it every Saturday. Everyone spills into the park and performs. The whole neighborhood comes. Families, kids, and sometimes scouts from the labels, too.
So that was the plan. I think I get why it was so important.
Yeah. My crew arranged to be on early 3 to 4 so I could make it there and get back here in time. Thing is, my uncle knew a couple labels was going to be there. My crew needed me. We're good enough to get signed.
Fareed, I'm so sorry. Must have been terrible to miss it.
It was violence. If the staff just took 30 seconds to try to understand. Instead, I become the problem. So I'm drugged against my will and locked in a 10 by 10 for the rest of the Saturday. I mean, do you have any idea what it was like for me between 3 and 4 p.m. locked in that room? Violent. It's violent and racist. You know what I'm saying?
Racist.
Yeah, no shit, Doc. Racist, like you white guys. God, sometimes your head is stuck so far up your ass. I mean, I don't even know how you breathe. Okay, Doc, so answer me this. Define racism.
Okay. Racism. Well, racism is judging another person not by who they are, but by some superficial quality about them, like the color of their skin.
Okay, and what else?
And what else? Okay, they assert power or privilege to take something away or to otherwise diminish that person.
There you go. I'm real proud of you, Doc. Very good. That was textbook. So, given your 25 years of training and your 103 diplomas, is your profession racist?
Well, I don't think I can...
Well, I don't think I... Just stop and listen up. I've been in and out of places like this since I was 12. I've been process grouped, force drugged, restrained, constrained, and shamed. I've been stripped, studied, stereotyped, and stigmatized. And you know what, Doc? No one has ever asked me what I listen to, not once. No one has asked what I care about or what I love. No one. Nothing. Until you. And actually, the only real thing you asked me was what I wanted to do that Saturday afternoon. So, have I been judged on superficial qualities? Have I been diminished and faced the power of privilege here? You better fucking believe it. And how the fuck can you help me if you haven't even tried to know me?
I can't argue with you.
And another thing, this George Floyd business, I know you probably think you so woke, and I have to put up with all of your "look how woke I am" statements at every fucking morning community meeting about your outrage at all the racism that you now say has been here forever and everywhere, but somehow you never really noticed it before. Yeah, all right. Give me a fucking break. Let me tell you something, Doc. I've been stopped by the cops. So have all my friends. Probably for nothing more than the color of our skin. And you know what, Doc? As bad as it is with the cops, that shit is way worse in places like this.
How so?
Look, shit happens in our lives. Maybe we're scared about it. Maybe we're angry. Maybe we feel like we got to protect ourselves or our brothers and sisters. Maybe we feel the only choice we've got is to check out of life or to use drugs because we can't take the pain anymore. We've lost hope, like we feel like there's no future for us. And then we get sent to places like this. Maybe at first we have some hope. You know, people seem nice and they say they want to help us, but no one really asks what's going on or about why we feel the way we feel or why we do what we do. Instead, we're told we have bipolar disorder or intermittent explosive disorder or ADHD or some shit like that, which only tells us that we're the problem. It's all about your disordered heads. And then, if it's all about our disordered heads, you can control us, shut us up with drugs, lock us away. Don't need to listen to us, of course, because we're disordered. And disordered people, we don't have the right grip on reality. Bullshit. Took me a few years till I was like 14 or 15 to really realize that there is no help to be had in a place like this.
I am so sorry. I'm sorry to hear what it's been like for you, Fareed.
And you call it therapy? Like it's meant to help us? Even the cops don't have balls to say something like that. Think about this, Doc. When I was thrown into that room on Saturday and heard the key locking the door, no matter what I said, no matter what I did, no one did anything to help me. Let's listen to Fareed to find out why he's so upset. The only thing that flashed in my mind was the image of George Floyd with that racist cop's knee on his neck. And I felt it. I felt it.
I'm not sure I even have the words for it. I do hear you. I think I understand what you've been saying, and it sounds like things are so stressful for you. How do you manage all that stress?
My music. I'd really be insane without it.
Yeah, you've mentioned music a few times since we started talking. Tell me about that. It's clear music means a lot to you.
Hey, Doc, it's a bit like this. I must regroup my thoughts and kick the next ones from my people. Please don't be deceived by the ugly slice of evil. The world is kind of cold and the rhythm is my blanket. Wrap yourself up in it. If you love it, then you thank it.
Wow, what is that?
That is Tribe, Doc. The Tribe. The Tribe? Tribe Called Quest? Have you never? Oh my God. Like Q-Tip, Fife Dog. Oh my God. Have you never heard of A Tribe Called Quest?
No.
Oh, fuck. Damn, now I feel worse for you than I did before. Oh, it's from Verses from the Abstract on the Low End Theory.
Sorry. No.
That sucks. Yeah, the rhythm is my blanket. That's for fucking sure. Do me a favor. Play Low End Theory tonight.
I will. Seriously, I'm excited to hear it, Fareed.
It's something you won't forget. Seriously, the beat, the rhyme, the flow.
What's that?
What's that? Oh, shit. You don't know what flow is? Oh, you have no clue.
I guess I don't. So what's flow?
Flow in a song is the rhythm of the words. It's like the connection between them, the way that they're spoken. Makes the song fly right up to heaven. Flow is, well, you can't really use words to explain flow. Listen to this, Doc. Just try to catch my flow. Stir from a young with a laid-back tongue. The aim is to succeed and achieve at 21. Just like the Ringling Brothers, our days in astound. Captivate the mass cause the prose is profound. Do it for the strong, we do it for the meek. Booming in you, booming in you, booming in your Jeep. Or your Honda, or your Beamans, or your Legend, or your Benz. The rave of the town to your froze or your friends. So push it along. Trails we blaze, we don't deserve the gong. Don't deserve the praise. The tranquility will make you unball your fists. For we put hip-hop on a brand new twist. A brand new twist with the homie Alistic, so low key that you probably missed it, and yet it's so loud that it stands in the crowd. When the guy takes the beat, they bowed. So raise up the squire, address your attire. We have no time to wallow in the mire. If you're on a foreign path, then let me do the lead. Join in the essence of the cool out breed. The cool out to the music cause it makes you feel serene, like the birds and the bees and all those groovy things, like getting stomach aches when you gotta go to work, or staring into space when you're feeling berserk. I don't really mind if it's over your head, cause the job of red directors is to wake up the dead. So pay attention cause it's not hard to decipher, and after the horns you can check out the fifer.
Fareed, I never heard anything like that before. I'm not sure exactly what you mean by flow, but if it was the way you just sang, I like it. I like it very much.
Then I guess my job is to be your resurrector.
Resurrector? What does that mean?
My job is to wake you up from the dead. It's pretty good, huh?
Yes, yeah. Sure, you can wake me, but good luck, Fareed. You've definitely got your work cut out for you.
No joke, Doc. Flow to me is life. And it's survival, too. They can take everything away from me. Even lock me in solitary on Saturday afternoons, and unless they kill me, they can never take away my flow. You know, my dad taught me that you can hear flow in those old African drum beats and on spirituals on Sunday. You can hear it in jazz and in the blues. It's in hip-hop and in our rap. And that's why you could never beat me down. Why you could never really beat us down or chain us down. I'm in chains here, against my will, but my mind can never be changed because it slips on through with the flow. I don't think white folks will ever understand that. Shit. Whew. Way too serious. Way too serious. Sorry, Doc. I got carried away trying to resurrect your dead ass. Anyway, Low End Theory. Just please listen to that tonight.
Yes, Fareed. And I will. I'll listen. I promise.
Doc, I got a question for you.
Of course, anything.
You're supposed to be some expert in, the mind, right?
I guess so.
Guess so? With all your years of education, don't be guessing, Doc.
Okay, yes. I'm an expert on the mind.
Okay. You ever heard a song called Ghettos of the Mind?
No, I haven't.
Because if you heard it, you'd remember it. Believe me. Pete Rock, C.O. Smooth from their killer album, Mecca and the Soul Brother. It's my dad's favorite album, 1992. If you want to know my mind, listen to that. And with all respect, Doc, you don't know shit about my mind. Maybe you know your shit about the Upper East Side or folks with keys to Grand Mercy Park, but you don't really know kids like me. No fucking way. Damn. Bro, we should have met a long time ago. I could have saved your ass years of education with a 5-minute song and you'd be nasty now.
You may be right, Fareed, and I'm going to listen to it. You've given me a lot to think about tonight. I am listening to Ghettos of the Mind, Verses from the Abstract, and Low End Theory.
No, Doc. Verses from the Abstract? That's just a song on the album Low End Theory.
Right.
Shit, I should charge you.
Sounds like you and your dad share a love for music, huh?
My dad taught music from when I was a little kid. He knows his stuff. Every album, every song, every word. He was connected to the biz, too. He was a top MC, and he was teaching me. He always said we'd be in the biz together.
Sounds like your dad taught you a lot. He's very important to you.
People are complex. My dad had problems. He has problems. He's a bad drunk, got into crack, started selling, stealing. On a bad day, he would hit my mom. I had to call the police. I felt bad. He's been in the last 5 years. It's fucked. I don't know, it's crazy. I had plans with him.
Plans to go into the music business?
He promised. Fucking asshole. Shit.
Must be hard to think of your dad and all you had planned with him.
Just that. Fuck it.
Fareed, would it help to turn your music up in your earbuds? Go ahead.
Whoa, I'm about to wife Camilla. I'm catching all these bodies and I swear no one to miss you. Ayy, I be toasted with my glass full. Ayy, some people think that I'm an asshole. Ayy, if I teach them a class full, I'm coming back like my last name Hassel. Ayy, hit you with a KO, yeah, I lay low, fearing wild like I'm cable. I ain't playful, leave a nigga disabled. Yeah, I'm painful, stay loaded like a train full, turn it fatal. Yeah, hit you with a KO, yeah, I lay low, fearing wild like I'm cable. I ain't playful, leave a nigga disabled. Yeah, I'm painful, stay loaded like a train full, turn it fatal. Nah, I don't give a fuck, nigga, so what's up, nigga, I be
He promised.
It must be painful to think about. All the hopes and dreams you had invested in your dad.
I don't like promises that get broken. It fucks me up. Like kryptonite, you know? My girlfriend, she broke up with me right before I got here. We talked about having kids together. Then she broke her promise. Didn't handle that one too good. I feel bad about that.
I think it's really important that you're noticing these promises being broken and how you react. Maybe that had something to do with last Saturday and what happened. I'm not saying it's your fault. Just saying it may have made things worse. Maybe thinking about your dad and his promise, it gives us a sense of where this might come from.
I don't know. Yeah, I guess. So, Doc.
Yes, Fareed.
Are you gonna tell him that I should go to that crazy unit?
I know you're really worried about that, Fareed. And you know that my job is to assess that possibility. So I need to thoroughly assess all aspects of the report, and then I need to talk to the other...
Wait, so you're really gonna tell him to send me there after all I fucking told you? You fucking asshole. You're an asshole. I knew it. Told myself as I was being escorted here to just keep my fucking mouth shut, and then you get me to spill my guts out to you even though I didn't want to. Real good. Me? What a fucking lame ass I am. Thanks for the shit, Doc. You're giving me quite a lesson today. I'm out of here.
Fareed. Please, wait. Sit down. I certainly don't want you to have to go to that adult specialty unit. And what you've shared with me so far, it helps me to find ways to help you so that you don't have to go there. I think I can help.
Why should I fucking trust a word you say?
Okay. I can't expect you to trust me. We're strangers. It's foolish to trust a stranger. I don't trust strangers.
Okay, so again, Doc, why the fuck should I trust you?
I don't think you should trust me until I give you a reason.
And what reason would that be?
You're expecting me to tell you the reason you need to determine my or anyone else's trustworthiness? Fareed, that's not for me to say. That's up to each person to decide for themselves based on their own experience and their own needs.
Okay, I see your point, but how can you even consider sending me to that place for violent adults after all I told you?
Because I don't trust strangers, Fareed. And you are, until proven otherwise, a stranger to me. Now, that doesn't mean that I don't believe what you said. You described what happened here in ways that seem compelling and authentic, but are you really asking me to have no doubt about anything that you, a stranger, says to me? Especially as you are motivated for me to have a certain opinion about you? Is that what you're asking me to do here?
No, I'm not. Nah, I get it. You know, for a white guy, you make a surprising amount of sense.
Look, I get why you would have trouble trusting someone like me. And I get why you would not want to have anything to do with me. But I also hear something else in what you say. I know you said when you were 14 or 15, you lost all hope that anyone here can help for what you need. But I, at least, hear a small part of you that still has some. And I want to honor that hope. I'm glad you're sitting down now. I hope you will choose to continue to work with me, to give me a chance to help. I know you've been hurt a lot, and I have no intention of adding to your pain.
Okay. I'll stay. I'll give you a chance to show your stripes.
Good. Good. So, here's what I have left in your evaluation. I have a few more questions for today. Then I'll need to talk with people on the unit to get people's perspective of you. Then I expect I'll need to meet with you again tomorrow for some follow-up questions.
Great. That's just great.
Fareed, for what it's worth, I've long ago learned to trust my own eyes over whatever anyone tells me I should be seeing. Is there anyone you'd like me to talk to? I know that you have pretty bad feelings about most people here, but are there, from your point of view, any good people you think I should talk to?
Any good people?
Yeah, good people. By that I mean people you feel have your back, people who are in your corner.
Good people. Yeah. Lots of good peeps here. Absolutely. You know what they say about good people, don't you, Doc? You know the triumph of good people?
The triumph? What do you mean, Fareed?
You know. Good people, bad shit, the triumph.
I'm sorry, I really don't know what you mean.
Doc, sometimes you're a dense motherfucker, you know?
Maybe I am Fareed, but I really want to understand it. I'm not following.
Okay. Good people. Good peeps. How did get it through your skull? Oh, okay. Jessica. She's a good peep for you. Jessica, the skills group therapist. Very nice lady. Always have a smile on her face. Good people, everyone says. So, the triumph of the good people, like our fucking skills group therapist, Jessica. You want to see triumph? I'll fucking show you triumph. Monday. It's time for skills therapy group. I hate that fucking group. But I said to myself, to get out of here, not to have any time in solitary, I'll go with a smile on my face. So I'm sitting in group, minding my own business. And that good fucking peep Jessica, she calls me out. Said that I should talk about what happened on Saturday. Says I need to be accountable for my actions, to take responsibility. She's, what? I don't know, 24, 25. She grew up where? Upper East Side, Westchester? Who the fuck knows? Definitely not South Bronx. She knows nothing about me. She's never even asked. She knows nothing about my family. But I try. I'll make the effort to explain where I needed to be. That I needed an MC for my crew in the park. The whole story. And you know what she says? She says, Fareed, I'm not sure you should be listening to that music so much. The lyrics can be so antisocial and demeaning to women. Maybe it's not good for you while you're trying to get better. I swear to God, that's what she said. So I looked at her in silence. Nod my head, not a word. What was I going to do? I didn't want to lose it, of course. I calmly stood up, walked out of the room, down the long hall to my room, laid on the bed. Staring at the ceiling, wondering what would come next, something had to come next. Because leaving group without permission is a big fucking no-no here. So I knew it had to be something. The next thing you know, I hear the footsteps. Okay, here they come. Lynch mom on the way. Didn't have to wait long to find out. They bust into my room, demanding my earbuds, said my use of them was disruptive. Leave my buds alone, fuck off, I yelled. They came closer. I grabbed my ears to keep the buds out of their grabby paws. Nothing I could do though. 4 big guys grabbed my arms and hold them down so that good peep nurse Christine could pop the buds out of my ears and lock them away somewhere. Told me that I've abused my privilege to use them. And while they held me down, I saw again that racist ass cop's face and felt his knee on my throat, ready to squeeze the black life that doesn't fucking matter right out of my body. And I couldn't breathe. So, Jessica, good people. Jamal, good people. Christine, good people. Dr. Lewis, good people. There's like 30 or 40 good peeps who work here. The doctors, the therapists, the staff. And those fucking good people either took my buds away themselves or they knew my buds were taken. But either way, they put me in solitary themselves. And they knew that I was in solitary. They either pressed their knee on my neck or they knew that the knee was there in its place. So, good people, Doc? Well, that's the fucking triumph. That's the good fucking triumph for you. You know what they say about good people? You know the old saying, don't play dance with me. You know that saying? You know what the fuck I'm saying?
Yes, I do.
So say it.
Say it? You want me to say it?
Yes, just say it, bro. Fucking say it.
Okay. I understand, Fareed. The old saying, the only thing necessary for the triumph of evil is for good people to do nothing.
Exactly. There you go, Doc. That wasn't so hard, was it? Bad shit happens when good people sit on their hands, mouth sealed shut. Take another look at that video of George Floyd's murder. This time, don't look at Floyd or his killer cop. Look around at everyone else who was standing there and watching it all. Then, you'll get the fucking triumph.
That's...
I know. That shit is hard to take in. Especially if you've never been on the other side of the knee. So, Doc, you've asked me a shitload of questions today. I only have one for you.
Yes, Fareed, please, ask me anything.
Are you good people?
I think...
Sorry, looks like you're having some trouble. I apologize, I wasn't specific enough. I'll give it another try. Doc, will you be good people when you're writing your report? That's what I'm asking.
I get it, Fareed. I get it. I do.
And I get it too, Doc. You got a job to do. You're just following... You know what I'm saying. You seem like a good peep to me. You really do. I expect you do your very best with your report. I even put you on to some real music too. And now you feel like even less of a stranger to me. And believe me, that's fucking strange. I feel that way about an old white guy. So maybe, there's a little trust growing here. My life is in your hands now. And you seem like good people, but you know what they say about good people.
Yes, Farida. I know what they say. I definitely know what they say. Thank you. Bree, thank you.
Critical Moments is made possible by the National Child Traumatic Stress Network and is produced in partnership with the University of Connecticut's Center for the Treatment of Developmental Trauma Disorders.
Trying to stay righteous while I'm flying, I'm the pilot. My life is color purple, cause all I see is violet, and all I see